Bienvenidos. Welcome, everyone. Good afternoon. Thank you to each and every one of you for being here today. We're very pleased to be able to welcome those of you who have been with us for a long time, and also those of you who have been here since the beginning. I'm Dr. Daniel Turner Lloveras, Executive Director of the Latino Coalition Against COVID-19. Today we have an amazing panel for you today on a topic that I think will resonate with many of you. We'll be looking at and discussing the importance of talking or how to approach Latino parents when discussing COVID-19 vaccines. If you look at the data, if you look at the numbers, the disparities are still there, the gaps are still there. And one of the ways that we think is how we can close these gaps is approaching Latino parents in a way that is non-judgmental and really facilitates discussion and helping answer the questions that allows them to make their own decisions about these vaccines and decide that whether or not it is in their best interest and their family's best interest to get vaccinated. I want to thank everybody who helped out to put this panel together. Judith Flores did an amazing job, and everybody else behind the scenes. Marlene Tucker is helping behind the scenes. You may not see her, but she's there making things happen. If you haven't joined us and the coalition, I encourage you to do so. You can visit our website at lcac19.org. And you should see a form there that is easy to fill out. And if there's any questions, feel free to reach out to any of us. You can email us at members@lcac19.org. Without further ado, I would like to pass the microphone over to Judith Flores so that we can get this discussion started. And I'm excited to hear everyone's thoughts and ideas that they'll be sharing today. Thank you.
Muchísimas gracias, doctor, y buenas tardes a todos. I have had the pleasure of working with the LCAC for a very short period of time, but I have had the benefit of being able to learn from a multitude of colleagues across the nation, and today is no exception. I want to start by just agreeing and supporting what Dr. Turner Lloveras has said, and that is that vaccinations are maintained as our most important protection against COVID-19. They are still the thing that will keep us from having severe disease and from death. And it's important to know that we also, having this vaccination protects our children because it broadens that protection to our families and to our community. The vaccination rates for children are not broken down by race and ethnicity, which is something we would like to see soon. But right now, the CDC information tells us that about 30% of children 5 to 11 have received their first dose, only 30%. And about a little over 66% of children 12 to 17 have received that first dose. So there's a lot of work to be done. A recent survey by Unidos US in October of 2020 looked at Latino parents and their attitudes and what they considered to be barriers for getting their children vaccinated. And in general, Latino parents across the states that were surveyed were found to be highly concerned about the impact of COVID-19 on their families, on their children, and on their well-being and their ability to make a living. About 84% of them had already been affected in some way by the pandemic, with half of those having been directly infected or having had a loss in their family. Just think about it. That's a lot of loss among children, a lot of pain, and a lot of children that have lost caregivers and family. Latino parents in general support widely measures of environmental protection. They support vaccination, and they have been vaccinating at a rate of about 62% nationally, which is slightly higher or has just caught up to the, at this point, to the white cohort. Remember, there were some changes around Omicron in terms of vaccination rate, but generally the vaccination rates have been good. However, they continue to experience barriers, and these barriers are identified as access to a healthcare provider. They're identified as availability of information in my preferred language and related to my culture. And needing resources to support this free vaccine. So we're going to start with, I have the pleasure of introducing this panel, this wide panel with lots of experience. And I would like to start with Dr. Romero. And I'm going to ask Dr. Romero to really help us with the clarity around issues of the vaccine itself, around issues of safety and efficacy. Dr. Romero is the immediate past chair of the Centers for Disease Control as a member of the Advisory Committee on Immunization Practices. On this committee, he helped inform the use and development of these COVID-19 vaccines. He is also a member of the American Academy of Pediatrics, their Committee on Infectious Diseases, and an associate of in the Association of State and Territorial Healthcare Officials. Welcome, Dr. Romero, and I want to give you the floor. Thank you so much.
Gracias, Doctora Flores, and Dr. Turner Llovera for inviting me, and LCAC for allowing me to address the group and the population in general watching this. So I think my introduction is sufficient, and I'd like to move into the overview of the vaccines, and we'll answer any questions that you have afterwards. But let me begin, because I think one of the things that we need to do is inform parents and Latinos in general how this vaccine was approved. And this is going to be a very abbreviated session, but I'll go through this. So this has been the most scrutinized and is the most scrutinized vaccine available today and ever in the world. There are currently five safety systems evaluating the safety of this vaccine. And from the very start, both the pharmaceutical manufacturers, the FDA and the CDC made it very clear in well-stated documents that safety would be paramount before any vaccine would be approved or licensed. And they have held very true to that. So, the process has been accelerated, as many people know, and that causes some doubt and some concern about the use of these vaccines. Normally, after the investigational phase in non-human subjects, and move on to a clinical phase, which is consistent of three parts: a phase 1, a phase 2, and phase 3. Each of these with increasing numbers of individuals, with a standardization of a dose, and then analysis of each phase before you move on to the next phase. And eventually, then submission of an application to license the vaccine from the FDA, and then passing that on to the CDC, the ACIP, which then makes a recommendation for its use. And these recommendations, both to the FDA and to the CDC, by their advisory groups, are only recommendations until the director of the FDA or the director of the CDC say that it's appropriate, and then that goes into formal statute. So it's important to note that one of the reasons why these vaccines, current COVID vaccines, have moved so quickly is that prior to this, we've had other pandemics or large outbreaks due to coronaviruses. So we've had a pandemic already from a SARS-CoV-1 that occurred very early in this century, so in 2003. And then more recently, we had an outbreak of Middle East respiratory syndrome, which is highly lethal. And in both of those cases, vaccines entered a prototypic stage, so that they were developed and went as far as maybe phase 1 or phase 2. And so the knowledge from those particular viruses, which are cousins of the COVID, SARS-CoV-2, informed the development of the vaccine, and that's how we moved quickly. The other major change was that instead of running the vaccine sequentially, 1, 2, and 3 phases, one after another, they ran the phases in tandem, so that you would start phase 1. When phase 1 looked good, then you would begin phase 2, finish phase 1, take the data, inform phase 2, continue phase 2, start phase 3, and then finish phase 2, and then finish off with phase 3. And then lastly, unlike what is traditionally done, the vaccines actually were made prior to the actual completion of the study, so that the U.S. government, through their Operation Warp Speed, funded and purchased large amounts of this vaccine to be made for development, for use in the public sphere during phase 3. And in that way, we didn't have to wait another year or 6 months in order to get vaccine available. And so this total plan compressed the development from 10 to 15 years to about a year. But again, I want to stress that these are extremely safe vaccines. So again, on top of this, we have independent individuals, so independent experts that advise the FDA, and that's under that VRBPAC group, the Vaccines and Related Biologicals Advisory Committee, that make recommendations to the FDA for approval or licensure of the vaccine. In this case, initial EUA approval. And only after they have reviewed the data and made their report will the director of the FDA make a decision about whether to approve the vaccine as an EUA or give it full BLA approval. Once that's done, then again, another independent non-governmental group, that is the ACIP, the Advisory Committee on Immunization Practices of the CDC, then again reanalyzes the data, looks at how best to use this, and makes a recommendation to the CDC director, who in turn takes that information and decides whether it's appropriate or not. So you have non-governmental agencies weighing into this decision. So it's important to note that the safety data is looked at continuously. That is, that this is not just a static one-time look. There is actually a subgroup within this ACIP called the VASS group that looks at this data on a weekly basis and looks for signals that are of concern. And if they are identified, then they're further analyzed and brought to the full ACIP and discussed in an open public fashion. So both the meetings from the FDA and from the ACIP are open public meetings. So nothing is done behind closed doors, and the decision and the discussion about making these recommendations is held in public. Now the data is all collected behind the scenes, but presented in a public fashion. So these are open and available to everyone. Lastly, let me say that these vaccines are incredibly efficient in preventing severe illness and in preventing deaths. We know now that we need a booster dose for the COVID vaccine, for COVID vaccines for primarily the Omicron. We know that the vaccine, the immunity falls over time, and we want those individuals to get a vaccine booster. Now, because this is such a new virus and these vaccines are new, we are learning how best to space these out and to give them. And what we thought was going to be a 2-dose vaccine simply has turned out to be the need for a booster dose. And we know that is the case for other vaccines, such as tetanus, such as measles, such as influenza. And so this vaccine is no different than the other vaccines. We're simply learning as we go along how to use it. And we continue to show that these vaccines are very safe. The last thing I want to leave you with is a concern that many parents have, and that is the development of a condition called myocarditis. That condition is extremely rare after having received a vaccine. And it is very, very common. It's 15 to 16 times more common in individuals that have gotten natural infection or infection with COVID than with individuals that have been vaccinated. So the vaccine is protective. And we can talk more about the issue of safety and specific issues. But again, this is not a benign disease, and the vaccines have been developed with extreme scrutiny and continue to be scrutinized as we move forward, and will continue to be scrutinized in the years that come. So I'll stop here in order to remain within my limit of time and pass it back to you, Dr. Flores. Thank you very much for allowing me to address the listeners.
Thank you very much, Dr. Romero. I think there was a question around translation. We will answer that later. I believe when we record this, we will have a scripted translation for you. Just going forward, and thank you, Dr. Romero. We will be talking a little bit more and asking you some more questions about the issues of the vaccine itself. So I wanted to say that just to note that Univision has reported that the Hispanic community in the U.S. are the perfect victims of disinformation. Over half use social media as a primary source of information around the COVID vaccine and COVID itself. Young Latinos are twice as likely to use a messaging app like WhatsApp or Telegram than other groups. So last year, for example, a Voto Latino poll documented that the unvaccinated Latino still believes most of that vaccine myth and gets that information from social media. So we have a lot to discuss about misinformation. We have a lot to discuss about here with Dr. Ilan Shapiro about the trusted messenger that we always talk about and how we can, what strategies work for the trusted messenger in our communities. So I have the pleasure of presenting Dr. Ilan Shapiro. He's the Chief Health Correspondent and Medical Officer for AltaMed in California, where he also is a practicing physician. He's well known for his work in creating binational public health programs, reaching Hispanic communities across the border to Mexico and other countries. He acted as a medical advisor for the General Consulate of Mexico in Chicago and as a member of the educational board for A Tu Salud. Many of us have seen and benefited from his contributions on national media, on Telemundo and Univision, especially during this pandemic. So, Dr. Shapiro, you have the floor, and I have the pleasure of introducing you. Thank you for being here.
Dr. Flores, it's really a pleasure. And it's such an important topic for our community, especially because sometimes we feel that, we are vaccinating ourselves against the virus, but in reality, a lot of the times the problems that we're having with information and just communication within the community, it's something that has been very, very hard to see. And sadly, a lot of our families have been, hurt because of this. And how do we start all this conversation? First of all, I'm going to give you a couple of examples and a couple of tools on where and what you can actually do. When we are hearing a lot of things, we need to remember that we are not fighting human to human. We are fighting human to virus. That's the first thing that we need to have in our minds. At the moment that we are right now asking or having questions regarding the vaccines, just step out, because all of us have had fear about a lot of medical procedures, and a vaccine is part of it. Then we need to acknowledge, first of all, that we are there and we have questions, and that's perfectly fine. But a lot of the times when parents actually come directly with me at the office, the first thing is, I hear you, I'm a father, I'm a pediatrician, I do want to figure out what's happening. And part of the misinformation is when you break the chain of information. And that's when everything gets, sad and slow and it doesn't work out. Then one of the most important things that we need to do is making sure that we acknowledge the fears, because it's real. That's the first thing. The second one is making sure that we are hearing out what's happening. A lot of the times we are just starting to bombard our patients or families in the conversation of, no, that's not true. This is true. It's not about that. It's about them and us trying to bridge this communication and conversation to make sure that they are happy and healthy and make the correct decision. And make sure that you actually let them know that, part of this is making sure that they understand that, whatever decision they make, you will still be with them. Because a lot of the times they feel disenfranchised. And that happens because we put a lot of labels that you're a pro-vaxxer, I'm anti-vaxxer. No, we're humans. We have questions. We want to make sure that, for us, it's the best thing to get vaccine. Why? The same thing with our kids, especially when we're talking about our kids. And we know, and I'm very thankful for Dr. Flores' presentation, this is not just a simple cold. This is something that has a lot of complications and consequences for our community. Then we need to make sure that we address that part. The second part of any conversation that we have with the community is making sure that they know that what's the real stuff that we know about the vaccine. Half of humanity have been already vaccinated. Fact. And, all the fears that we had, or the fears that were playing probably like 18 months ago, they're not happening. And that's important to know and share with that part. The other thing that we know as a fact is that people that are vaccinated and boosted, they have a lower possibility of ending up in the hospital and with complications. And that's a fact. And of course, we need to talk about side effects. And, right now, Dr. Flores took away a lot of the talking points regarding myocarditis and actually what's happening. But that's very important also to have, acknowledge that, yes, there's pain on the arm, there's redness, there could be fever. But I can assure you that my kids did way better than me. And one of the things that always helps is to share why we got vaccinated or why we vaccinated our kids. And that's the part that I share with them, that we need to make sure that, we need to measure fear. And fear is something very subjective, but when we have a lion and it's behind us and it's going to bite us, we run faster. But right now there's no lion behind us. Then fear only makes us be paralyzed and not make sensible things and just playing the waiting game. I will wait. I will wait to see that it's better or more people are in front of us or a lot of other variables in front of the conversation. And right now it's not 2020, it's not 2021, it's 2022, where we have millions of teenagers and other kids being vaccinated safely and they're being protected. And especially right now that, MIS-C is the rates are going up and we have all these other things creeping up. It's clear right now. One of the things that we can do is have a conversation about vaccinating our kids. And we know that kids right now need to be at school. They need to be at school. They have suffered a lot on the developmental part from being, alone at home, the social skills. And right now we want them to be safe there. And that's the things that I was measuring. Am I more afraid of the disease or that something that I know that it's, hurting people and hurting kids and doing all this stuff? Or am I more afraid of something that, we're not seeing yet? On reality, and after a lot of months, it's clear that, I wanted to give the same protection that I was giving to myself, to my kids. And of course, there was a lot of back and forth. And one of the things that we did wrong, and that's the fault of every public health official and anybody that's around us that it's involved with messaging, we did a huge error on communication. Why? Because we were not truthful. And I'm going to give you an example right now of what's happening in the past couple of weeks. First, December, full-blown pandemic wave, we were worried. And we didn't communicate that the same way as 2020, 21, that probably March and March and April, the cases will go drastically down and we'll need to be having, and we need to set expectations. That the expectations are that, there will be good days, bad days, and we need to create more barriers if we have more issues. And we need to create less barriers if we don't have a lot of infections. And we didn't set that expectation. And right now, a lot of people are, taking out the mask and doing a lot of things. And people are confused. Our community is confused. And we need to make sure that everybody's clear that masks are here. It doesn't hurt. You can actually use it and have other opportunities around you to make sure that we're taking care of absolutely everybody around you. Misinformation and disinformation usually brings a lot of things, and we need to attack it as it is. There's amazing information in Spanish already in Kaiser Family Foundation, also the American Academy of Pediatrics, and other great groups that can actually give videos that are short, nice, culturally aware, to make sure that we create conversation with our patients. And the last part of any conversation that we have regarding misinformation is, I'm here for you. If you need more information, give them links, give them place, give them an opportunity to look and search in real places and make sure that they have your phone number. A lot of times, all of us, we need a couple of back and forths. We have conversations. We have a lot of concerns. We have a lot of things. And that's the only way that we will breach anything, especially right now. And that's, my last remarks, that right now that we're getting close to, finishing this weird cycle of school year, we will have a new one. And a lot of parents and families will feel that we're done with this, and it's not true. We still have kids below 5 years of age to get vaccinated. We have a lot of opportunities to vaccinate our kids above 5 years of age, and making sure that we are sticking to the points that we want to protect our families, children, and most importantly, to create conversations. I'm tired to see the microchip videos. I'm tired to see all this WhatsApp interesting messages going flying and back and forth. But one of the most important things is make sure that You're there, you're open, you create communication. You can, with the tools that I gave you right now regarding be open, share your ideas, share why you got vaccinated or not. What are you feeling? How was your day? Why are you vaccinating your kids? That stuff actually are important because we're humans and we want to hear humans. We don't want to hear a sergeant. We don't want to hear someone that is giving us order. We want someone that is sharing and it's not mandating anything. Then last but not least, remember to vaccinate yourself against fear with a dose of truth. Dr. Flores, thank you very much, and I will be here.
Yes, muchísimas gracias, Dr. Shapiro. Voy a decir, there is no active translation with this presentation, but I believe the transcript will be translated at some point. If you have a question and you want to place it in Spanish, we have at least 3 or 4 of us that can speak Spanish and answer you, and we will be able to answer you in Spanish. So I want to go on to, and thank you so much, Dr. Shapiro. I want to go on to our next panelist. So our next panelist is really going to look at the issues of partnership. So as healthcare providers and physicians and nurse practitioners and everyone else, we need partners. We are not honored in the community. One of the things that we don't do very, very well and are not always taught very well as physicians is really to go out into the community, have those conversations, and be able to do it in languages and in a culturally competent manner. So we need partners. Jenny is one of the people with which I actually worked with the healthcare education network in New York. And she's one of those people that presents that link that can bring us to be able to get more information into our communities and resources that are needed. So if you bear with me, I will be able to introduce her. She is a healthcare advocate with Health Education Project of New York. She has done a significant amount of work in community with health leaders, healthcare organizations, and the healthcare organization in Staten Island. She and her organization represent a bridge that allow us to get vaccination, testing, information about healthcare literacy, and on many topics, including chronic diseases. Without any more further ado, I want to introduce Jenny Palaguachi. Jenny, you have the floor.
Thank you so much, Dr. Flores, and thank you to the LCAC Coalition for putting together this informative discussion. Just briefly, I want to say that the Healthcare Education Project is a community-based advocacy organization that was formed by 1199 SCIU and Greater New York Hospital Association to be able to protect and expand access to quality, affordable healthcare for all Americans through education, advocacy, and coalition building. And so we use our collective voice across New York State to be able to advocate for the well-being of our community and everything that it entails. With that goal in mind, when vaccines did become available for our communities, we continued to provide education by identifying the emerging needs in our communities, the resources available, the partners who were offering the resources, and also distribution outlets where we can get this information out and really reach the community members. We did focus on the underserved communities who honestly presented a large disparity when it came to the vaccine. When we created our outreach materials to educate our communities, we used trusted voices because we know that that's who the community would look towards when trying to figure out information about the vaccine. So we used medical professionals, faith leaders, community leaders. Dr. Flores was one of our trusted voices that was able to help us put together FQAs, videos that were accurate and easy to read, easy to understand for our families. This was used to be able to combat the lack of access to verified information that we were seeing in our communities. That is one of the barriers that we did experience. Our families were overwhelmed with information from so many sources. And as mentioned before, especially it came from social media and the news. Many families didn't even know who the CDC was or, who their government entity was. And so they trusted things that they already knew. And that led them to believe and repeat misinformation to others. And so misinformation began to spread In order for us to be able to combat this, what we did is use these trusted leaders in our community, use leaders who they have interacted with in the past to receive services, or just overall who they have seen constantly in their community. And we were able to use these leaders and provide enough information for them so that they can become a source of verified information. We also found that it was really critical to make sure that the literature and the outreach materials that were being distributed were concise and simple, that they were easy to understand, but also contained enough information to educate our community. And this, for us, specifically for the Latino community, was extremely important because we know in many cases our children are a primary source of understanding this information. And this is due to lack of language and also lack of education. And so we wanted to make sure that the information was easy enough for a child to be able to translate it back to their parent. We also don't know that in New York State, we have Latinos who can't read or speak Spanish fully. And so imagine they can't even understand English. And they are very versed in their indigenous language. So community partnership became critical when addressing this issue. We worked with organizations such as Redes de Pueblos in Queens to guide these community members in regards to understanding vaccine information and understanding the need to get vaccinated. However, this is still an issue and a barrier that our communities continue to face. We need more materials that are targeted to this specific population using their customs and also their language. And so that is something that we continue to strive for. We also saw that creating testimonials by these trusted leaders, especially faith leaders, were extremely important. Our Latino communities have a very deep trust in our faith leader, and so promoting digital content where they encouraged individuals to be able to get vaccinated made a big impact on the decision that these families were making. And so we also use these relationships with these faith leaders to be able to host pop-up clinics where we saw that there was a gap to access of these sites. We were able to spread information during service about the importance of vaccines, and they became a source of verified information for families that were coming to see them on a weekly basis. We also worked with parent coordinators in regards to vaccinating our children. We worked with them in schools to be able to develop webinars, information sessions, back to school events, to be able to address the hesitancy that parents had. We were able to provide testimonials, and a key practice that we saw work to combat vaccine hesitancy was working one-on-one with community members, so interacting one-on-one so that they can feel comfortable enough to be able to express their concerns and ask their questions. We used our existing relationships with community-based organizations such as food pantries to be able to have these one-on-one conversations and also provide vaccine information kits. And across New York State, we collaborated with community partners to be able to host these vaccine clinics in areas where we identified that there was a gap, right? And so we addressed the access barrier that our communities were facing. These events were very crucial in being able to vaccinate those people that were ready to get vaccinated but didn't have access to a site or didn't have the time or priority to be able to go out of their ways to be able to get vaccinated. And so our existing relationships and previous health campaigns played a significant role in getting our communities to trust the message and also to get vaccinated. You know, it was able to help us identify and also address the barriers that we were seeing our underserved communities were facing. And simultaneously with that, I just quickly want to mention, we did deploy a digital education and awareness campaign centered around a dedicated Instagram channel that has already generated over 430 pieces of content. It has reached over 400,000 people. And our team was able to collaborate with medical professionals, experts, to be able to provide answers to questions that we were getting as advocates in our region, but also online. and they were able to create short videos featuring these medical professionals answering questions. They were able to provide definitions and also explanations of important terms and concepts, such as who the CDC was. And so having this constant up-to-date information to be able to distribute throughout the multiple outlets that we had created, such as monthly webinars, community workshops, events regionally, really played a key part in us being able to educate our community about getting vaccinated. Engaging our community-based partners that have already the experience and also the trusted presence in our Latino community was very influential in our Latino community trusting the message that was coming to them. And having centralized information also was key to be able to make sure that in every encounter, we were able to provide access to vaccination sites. So I don't want to take any more time. Thank you, Dr. Flores, for having me here, and I look forward to the conversation.
Muchísimas gracias, Jenny. Thank you very, very much. I'm going to move on just so we can address some of the questions, but you have a lot more to say because I have witnessed your organizations at work. So I want to end the panel discussion presentations, not the discussion, with an acknowledgement that we all know that educators have consistently been identified as one of the most trusted sources of information. And it's very interesting because when the schools were closed, people were still trying to access school officials, educators for information, not only about getting their children back to school, but about the safety and efficacy of vaccines. And I've worked with many groups around that. Here to share some of what is going on at our schools that work is Brian Lewis. Mr. Lewis is the Chief Program Officer at EXALT, which is a unique program that seeks to provide an equitable future to court-involved youth in New York City. He has also taught courses in nonprofit management and other education issues, and is an adjunct professor at NYU School of Public Service, the John Jay College of Criminal Justice, and other academic institutions. Much of his work has focused on making educational systems more just and equitable. Welcome, Mr. Lewis.
Thank you so much, Dr. Flores. And it is an honor to be with this distinguished panel. Good afternoon, everybody. As Dr. Flores mentioned, I work for EXALT, and EXALT is a nonprofit organization that is based in New York City that works with 15 to 19-year-olds who are involved in the criminal justice system. So every young person who's in EXALT does have involvement in the criminal justice system. They've at least experienced an arrest. Some of our young people have had involvement as serious as incarceration, leaving incarceration and returning home, reentry into the community. Some of our young people have pending open cases that carry with them the threat of 10, 15, 20 years in jail if convicted of the crime. But one of the beautiful things about the work that we do at EXALT and our mission is that we work with each and every one of those young people, regardless of where they are on that spectrum of justice system involvement. And we ensure that they are able to get their cases closed, they're able to get their cases vacated, and that they're able to live lives that are free and clear from future justice system involvement. So I'm very proud of the work that I do at EXALT. I've been working at that organization for 8 years. We work with 15 to 19-year-olds who are in the criminal justice system, and 85% of the young people that EXALT serves identify as Black and Latinx. At least 60% of those young people that we serve are immigrants themselves or come from families where they identify as immigrant communities that come from the Caribbean and Latin America. And so there is a very strong nexus, unfortunately, in American society, but specifically in New York City, between the immigrant community, between people of color, and people who are involved in our criminal justice system. As many of you may know, New York City is a city of about 8 million people. And of those 8 million people, about half of the people in New York City are people of color. And so in a city that represents half people of color, in our jails and in our detention centers, we have 90% or more people of color represented in those institutions. So we have a real problem with racial equity, right? And I know I didn't come here to talk about racial equity per se. I came to talk about, vaccines and the COVID-19 impacts, but those two things are aligned, as many of our distinguished panelists have pointed out. And so I'll hit you all with a few more stats before I dive into some of the work that we've been doing to address COVID vaccines and, the virus, from our standpoint here at Exalt. One more stat that's really important, and some of you all may have seen this. In New York City today, from the last information that I saw from New York City Public Health Department, 85% of people in New York have gotten at least one dose of the COVID vaccine. 75% are fully vaccinated. We at Exalt have done our own internal surveys and our own data collection around this issue. We wanted to understand a few months ago, how many of our young people are verified to have had at least one dose of the vaccine, and how many of our young people are fully vaccinated? Well, we're not done collecting that data, but let me tell you where we are now. As of our last count, 52%, only 52% of our young people have had one dose of the vaccine, of any of the 3 vaccines that are available to them. 47%, only 47%, we can verify are fully vaccinated. So clearly there are some huge disparities here. And I just want to point that out because I say that we're doing some really good work, and I'll give you all some solutions and talk about our approach and some things we've done well. But there is much, much more to do, especially with our Black and Latinx communities, especially with our court-involved populations and people in New York City, and I'm sure in other parts of the country, and especially with some of our most low-income people who are struggling with these issues, because, oftentimes when we're talking about these issues, yes, we're talking about racial justice, yes, we're talking about equity, but we're also talking about fighting poverty, and fighting against the conditions of poverty many of our young people struggle with. So more into our work at Exalt and what we do at Exalt to address the issue of criminal justice involvement, but also to make sure that young people are making gains in terms of their education and to make sure that they're improving their employability. And then I'll get to the piece about the COVID vaccines. So at Exalt, we've created a program that is designed to address the most strong contributing factors of the school to prison pipeline. Our young people come through a course that is 6 to 8 weeks long, where they're learning about their lives, their communities, the skills that will help them to advance and to move forward so they can live a life that's free and clear from future criminal justice system involvement. We use the educational philosophies of the educational philosopher Paulo Freire, who said that, education cannot be banked into people, but instead that it must be constructed, that we have to have a dialogue and a consensus about what we mean when we're talking about education, because education is really the practice of freedom. And only when we begin to practice freedom toward our education can we have a real representative democracy in our society. So our young people are in classes where they're enjoying themselves, they're having fun, they're learning, but they're also building their skills. After they go through those courses, they are then sent to a paid internship. They work for 4 to 8 weeks in that paid internship where they get to learn how to be an architect, learn how to be in medicine, finance, any field of their wildest dreams. They get to work in and they get paid. We pay our young people $16 to $18 an hour to do that work. For most of our young people, this is the first time in their lives that they're earning a paid stipend. After they complete their paid stipend and they work, they come back to Exalt for a 2 to 3 week final engagement, and then they graduate from our program. And hopefully they continue to stay clear from the criminal justice system after that. 95% of our young people who complete our program do not get reconvicted of crimes and are not recidivating. So we know that our program is effective and it works. But we knew that when we encountered this pandemic, we were going to have to make some changes and we're going to have to adjust. So here's what we did to adjust to the pandemic. And then I'll also get into how we've addressed the issues of vaccination. When the pandemic hit, we decided we're going to develop a virtual model. And so we still are serving those young people in those classes. They're still going to paid internships. They're just doing it all through the computer. We also know that the issue of the digital divide is a serious one in our communities, and that many of our young people do not have internet at home, high-speed internet at home. They do not have computer access. So we shipped laptops and shipped computers with data plans to our young people's houses directly to make sure they can continue to connect with us for these virtual classes and also for those internships. We also were connecting with the judges and the district attorneys for virtual court, and we were enrolling our young people in school and making sure that they were making progress in school in terms of their credits so they didn't get too far left behind during the pandemic. So because of the tireless work that we did, we're able to continue to have our young people advance through a very difficult and challenging time in the pandemic. Finally, with the vaccines. So when the vaccines were made available to us, we did institute a vaccine requirement for all staff. 100% of our staff are in full compliance with that vaccine requirement. We did not institute a requirement for the young people because we understood that our young people are in very precarious situations. And as many of the panelists have mentioned, our young people need to make the decision, the critically informed decision for themselves to decide that the vaccine is the best choice for them. So what we've done for our young people instead is we've offered incentives. We offer a $50, $100, or $150 gift card for every young person who has a first, second, or full dose vaccination. We've also added a piece in our curriculum on the vaccines where the young people get to do their own critical thinking projects. They get to learn about the Tuskegee experiment. They get to learn about other moments in American history or in their cultural history where, yes, the government or the medical authority might not have had their best interest in mind, but they still, push forward to push for justice and understand that this too is an issue of justice. That in fact, maybe they think that they're fighting injustice by, looking at some of these memes and some of these other things that are misinformation on the internet, but to actually learn about themselves, their culture, their history, and to see the way COVID-19 is devastating disproportionately our communities, and to fight against that with the tools we have available, including the vaccines, is the best way to do it. And finally, we've had the NBA. We have a partnership with the NBA. We've had some NBA players send some paraphernalia, send some t-shirts, send some swag. We're working on getting NBA tickets, getting messages from NBA players, because we know that NBA players are credible messengers. We know that our young people look up to these figures and they listen to them, and that they are people that might be able to help them understand where they can get more credible sources of information and how to make more critically informed decisions. So I believe my time is wrapping up. I just want to say that for us at Exalt, this issue is an issue of equity and access. And so it's not just about making sure our people are vaccinated. It's not just about making sure that they have the right information. It's about making sure our people don't get left behind. In order to do that, we need to meet them where they are. We need to make sure we're speaking the languages they speak. More than 1/3 of our staff at Exalt are bilingual, Spanish and English speaking. We even have staff that speak Creole, Haitian Creole, or speak Quechua. We have a young person who is Mayan and who does not speak Spanish, but is from Mexico and so needs to be connected with. So we always have to meet our young people where they are, continue to make sure they have equity and access. And I'm so honored and thrilled to be a part of this community that is pushing for justice in these powerful ways.
Thank you so much, Brian. It was a very informative to listen to the kind of work you're doing, and it dovetails with all the other work that we're doing here. So I'm going to ask the panelists now to please come back on camera so that we can start answering some of the questions we have in the Q&A. If you are a participant and have a question, please put it into the Q&A, not into the chat, because it may get missed. Those questions that will not be answered today will be put on a roll, and we will be able to send out responses in the future. So I'm going to start with a question right away. And this question is for Dr. Romero. Dr. Romero, we're getting a lot of buzz, and people want to know the proverbial question. How do you answer someone's question when they say to you, my child is not going to get seriously ill, is not going to die, why do I have to vaccinate? So I'll start with Dr. Romero.
Sure, that's a very good question, an excellent question that a parent should ask. I mean, why should I get vaccinated if this is not a serious disease? So let me try to change your opinion about this being a serious disease. So there are conditions such as MIS-C, which occurs in 1 out of every 3,000 to 4,000 individuals that get infected, children, right? And that means even if you're asymptomatic or have very mild disease, you can develop this life-threatening condition. It can affect the heart, multiple organs, and place you in the hospital, and can leave you with long-term sequelae. So it's not just a benign disease. We also know that children that now have had COVID have a higher risk of developing diabetes, right? Azúcar en la sangre, requiring insulin in the future. So it's not a benign disease. We also know that individuals that have COVID have a higher rate of myocarditis that is more severe, life-threatening than the risk of getting the same thing from the vaccine, which is very mild, has very rare causes of death, right? And lasts only a small period of time instead of weeks. So overall, this is not a benign disease in children. It is a serious disease, and the long-term COVID diseases, which we still don't understand in children, can occur in up to 15%. In some studies, children that can't concentrate in school, can't engage in physical activities, that just are having a hard time recovering from this. So it is not a benign disease. No es un catarrito, as I say in Spanish, to parents, Spanish-speaking parents. I am a clinician. I see patients every week. Mm-hmm. And it's important that they understand that this is more than just what everybody says. It's a little cold. We need to protect our children. And more so, Latino families have extended families, correct? Right? Tenemos, we have the abuelos, los bisabuelos que at times live with us. And we need to protect them also. And those children can bring this into the family if not protected. So I'll stop there.
Yeah, there's one other second part to the same question. So I might as well get through that because my second question is for Dr. Shapiro. So what are the long-term effects? I'm worried. My children are going to have effects in the future from this vaccine today. Hoy vacuno a mi niño y mañana, cuando tiene 20 años, va a tener problema.
Again, otra vez, a very today is that this vaccine does not have long-term complications. And so let's break it down. Women, right? There's this concern that could it affect your fertility in the future? It cannot, neither male nor female. We know that, and we're watching that continuously. Can it have other effects that we don't know at this time on the heart? No, we don't see anything that indicates that this is a long-term complication of getting the vaccine. So as of today, our knowledge is that this is a safe and effective vaccine that does not have long-term consequences. And at the ACIP, in the CDC, we do a risk-benefit analysis or benefit-risk analysis of the vaccine. Is it safer to get the vaccine than to get the disease? Yes, that's the analysis. Right now, we think it is safer to get the vaccine than to risk getting COVID, because COVID itself will leave many, many more long-term complications, which I've already talked about, for the child and for the adult.
Thank you so much. Dr. Shapiro, I have a question for you. How can organizations balance correcting erroneous information about COVID-19 versus avoiding bringing greater attention to specific strains of misinformation and allowing it to spread? Or it's the old question. Maybe if we don't pay attention to it, it's better than to pay attention to this misinformation. What do you think, Dr. Shapiro?
Dr. Flores, a great question. There's actually tons of research right now regarding which myths and misinformation actually needs to be addressed and which ones are plainly not true and not even worth conversing about that one. One of them is the example that you were giving about fertility. The other one, it's very importantly that you need to name it. If someone is actually worried, we need to address that part. And most importantly, one of the things that actually work, because myths and misinformation will continue to evolve no matter what, we need to make sure that they know where to reach out for information. Then one of the things that I love doing is making sure that we create conversations with parents, with teachers, and making sure that they have a voice. A lot of the times, they feel outside of the conversation. They feel that they're telling me to do this. They're telling me to do that. I'm not understanding. I'm afraid, and I do not want to do it. Not because I don't believe in vaccines, because I have 3 jobs. I'm running from one side to another, and nobody's actually having the time to talk to me in the language that I understand. And that could be Quechua, Spanish, English, whatever. But this is the moment for sure that we need to do this and make sure that me as a practitioner, as a physician, one of the most important things is making sure that we're bridging the truth. And there's no myth that sometimes in social media that in a conversation you need to address it. It's a public health department. That's a different thing because you need to choose what are your battles and the resources that you're going to be doing. Then for schools and parents, please ask, and if they are not giving you a form, make sure that you get one.
Okay, thank you so much. I wanted to ask first Jenny and then Brian, when you have communities that have preferred language access issues beyond Spanish, you're talking about people that are from indigenous communities. How are you dealing with that? I'm going to start with Jenny and then I'm going to end with Brian.
Sure. Thank you, Dr. Flores. I did mention this a little earlier. We have been able to have partnership with different organizations that provide this language access, such as in Queens. I know one of our healthcare advocates has worked with an organization that helps this community specifically with translating the information, guiding them to where they need to go to get vaccinated, and even going with them to be able to, for them to be able to have access. But I think overall, that's an issue that we need to continue to work on. We need more resources, not just, for example, in Queens, but here in Staten Island, we do have a large Hispanic population as well. We do have a lot of Latinos who do not speak fully Spanish, who do not understand at all English, or cannot read fully in Spanish. So that is something that our organization is able to work on. But that is a big access that we continue to face, and it's something that has not been properly addressed. And so, that's an issue that we're working on.
Yeah, I will bring it to Brian now. How did you deal with that issue?
Yeah, the same way that Jenny mentioned, we work really hard to make sure that we're hiring staff that reflect the communities that we serve. And we're fortunate, we live in New York City. We have a lot of resources available to us. And, we're working in the courts and we're working in schools. And there are some laws locally that require that there's translators in certain languages. But I'm also aware that we're talking to a national panel and that, there might be folks who live in places where they don't have those legal requirements. So I see Daniel's call to action in the chat. I think it's important. We have to advocate. We have to make sure that we have those kind of legal protections. If you live in a place where those kind of requirements don't exist, we should fight for them. We're a part of that fight. But yes, organizations like ours need to hustle and connect and make sure that we're always talking to people in languages that they understand and finding those resources for them, for sure.
Yeah, I would support that, because actually I had the great pleasure of working with the Endangered Language Alliance, and I did about 28 sessions with 28 groups of people that spoke languages and were for countries that I had to learn about as a physician. It didn't help me just to speak Spanish and English fluently. That was not it, or French. It really was, and those were people that were in pockets that needed this information to make their decisions and were generally pretty ignored. I want to ask one last question. We're down almost to the wire. This has been an exciting panel. I hope we get to do it again with many of you, but I want to ask a question of each one of you, the same question. And I'm going to start with, we'll start with Dr. Romero because he was the first presenter, and then we'll go down the line. Things are changing. We're moving into a new episode or era of this pandemic. What metrics do you tell your patients or your communities to look for in altering their behavior? And also, what messaging do you give to those communities? We'll start with Dr. Romero, we'll go to Dr. Shapiro, we'll go to Jenny, and then we'll go to Brian. Sorry, Brian, you're always the last one. And then we'll end with Dr. Daniel, just Daniel Turner Lloveras. So we want to make this short, please, because we want to give him some time.
Sure, thank you. Gracias. So I want to preface this by saying that these metrics will change over time, just like the metrics today aren't the same that we used a month ago or 2 months ago before. Right now, the metrics that I'm telling people to look at are the number of individuals that are being hospitalized and looking at deaths in your community. When we're seeing significant number of deaths, at least in Arkansas, right? We're seeing 30 to 40 deaths a day, which is significant. That's telling me that there's disease in this community that is substantial and needs to be followed very, very carefully. And then, that's basically the message that I'm giving at this point.
For my part, the most important thing that I think that we need to be measuring is wellness. That should be the next metrics that we need to be measuring, because it's not a miracle why our communities were decimated the way that they were. It was because we had a lot of issues with social determinants of health that were not accounted for. And if we continue the same thing and we're just putting band-aids with vaccines and testing, it would not solve diabetes, violence, pollution in our communities, and other stuff that because of that, we had the horrible problems that we are having right now in the community.
Totally agree with that. Jenny?
Thank you, Dr. Shapiro. I just want to jump on to what you said. It's exactly what we need to look at, and it is what we're looking at now. What are the rates of HIV, right, that we have seen? What is the increase in diabetes? What about nutrition, right? Are our families eating healthier? Because we got to think back to how we were pre-COVID. We had all these issues. Diabetes was a huge issue in, all over. Obesity, especially in children, was a huge issue. We had a huge rate of obesity here in Staten Island. And so those are the things that we need to start looking at. Yes, as I definitely agree with Dr. Romero, death metrics are important, but a lot of our families are so tired of hearing, deaths and how many people are getting tested and how many people are becoming positive. People now just think like everyone is positive and that's it. So I think that's really what we need to look at. Yeah, we need to look at that, go back into our health education portion to see what are those rates
that put us at risk for COVID in the first place. Brian?
Thank you so much for this question. Unfortunately, it's the good old trifecta of unemployment, recidivism, and high school graduation rates. I mean, the impact that this pandemic has had on those three areas and our communities in particular on those three areas, we got to keep paying attention to that. And as I mentioned before, it is an equity and access issue. So the thing that we're saying to our young people and their parents, we can't get left behind. They already have vaccine mandates for almost all the internships in New York City right now and jobs. They already have vaccine mandates for schools to go to college. They have vaccine mandates in the jails, right? And so we don't want to get left behind. We have to protect ourselves and we have to keep up with the pace for equity and the fight for justice.
Dr. Daniel, you're on mute.
Well, I was waiting. I wasn't sure who was next.
No, it's yours.
I want to thank everybody for coming out today. We had an amazing panel. Hopefully you're able to leave this webinar with some information about how to approach the conversation with Latino parents. Not only that, but as you can see, Brian Lewis, when he discussed things that may not initially seem related to approaching Latino parents about COVID-19 vaccines, or what if anything, the pandemic has taught us how things that we have not initially thought of being an issue related to health are issues related to health. Everything is intertwined when it comes to community health, when it comes to population health, when it comes to social determinants of health. We're realizing that there's multiple moving parts, and in order to really have a conversation with a family, you should have an understanding of the different elements that make up that family and the environment that they're living in. In order to understand that, you need to understand that, for some families, there is a fear of immigration enforcement. For some families, there is a fear of sharing that they don't have enough food to eat. There's many issues related to how to approach a family. And I hope that everyone who was able to join today took some of this information and absorbed it and help you in your outreach to help build health equity in our Latino communities. And thank you for joining.
Thank you all so much. Thank you, Dr. Torriveras, and goodbye. Thank you very much. Bye-bye. Don't forget to take I think we have a survey also, a poll that's in there. Thank you.